Acebutolol is a beta blocker, a class of medications that affects the heart and circulation. Acebutolol hydrochloride is the active substance in acebutolol tablets. It is primarily used to treat high blood pressure, hypertension, and certain heart rhythm disorders. Indications. Acebutolol is indicated for the following conditions: hypertension, high blood pressure, ventricular arrhythmias, particularly premature ventricular contractions. How to use. Acebutolol tablets are taken orally, usually with or immediately after meals. The dosage is individualized based on the patient's medical condition and response to treatment. The typical starting dose for hypertension is often 200 mg once daily, and this may be adjusted by a healthcare provider. For arrhythmias, the dosage may vary and is determined by the severity of the condition. Contraindications. Acebutolol should not be used in the following cases: non-hypersensitivity or allergy to acebutolol hydrochloride or any of the product's components, severe bradycardia, slow heart rate, heart block greater than first degree, cardiogenic shock, untreated pheochromocytoma, a tumor of the adrenal gland. Precautions. Abrupt discontinuation of beta blockers, including acebutolol, should be avoided. Consult a healthcare provider before stopping the medication. Inform a doctor of any other medications you are taking, especially other beta blockers, calcium channel blockers, or medications for heart conditions. If you have a history of certain lung conditions, consult a healthcare provider before starting acebutolol. Side effects. Common side effects of acebutolol may include fatigue, dizziness, headache, upset stomach, cold hands or feet. Serious side effects can occur, and if you experience difficulty breathing, chest pain, severe dizziness, or fainting, seek immediate medical attention.